class को continue करते, we'll continue with the class. So in the previous video we had seen about the symptoms as well as the diagnostic evaluation. So in this video we'll see about the management of multiple sclerosis. So when we talk about this management of multiple sclerosis, so the thing that we do it is that first we start with administering corticosteroids to the patient. Okay, first we start with administering them corticosteroids. So what are the for which corticosteroids that they are administering? It is mainly this corticosteroids are administered mainly to reduce the inflammation of the nerves. Okay, so these corticosteroids are mainly given to reduce the inflammation of the nerves. So example, it includes prednisone and methylprednisolone, and this methylprednisolone it is usually given through IV. Okay, this methylprednisolone it is usually given through IV. So management usually starts with, like, we administer corticosteroids. Corticosteroids are mainly administered to reduce the nerve inflammation. So the corticosteroids which are administered are mainly prednisone as well as methylprednisolone. Methylprednisolone it is mainly given to through IV. Okay, it is mainly given through IV. So next management that we go with is mainly by plasmapheresis, Plasmapheresis. Okay, plasmapheresis. So the next management that we go with is plasmapheresis, Plasmapheresis. So this plasmapheresis we do only when the person is not reacting, the person is not reacted to corticosteroids. Okay, the person is not reacted to corticosteroids, we start with this plasmapheresis. So what is done in this plasmapheresis? So then this usually the liquid portion of the blood, okay, the liquid portion of the blood, it is usually removed. The liquid portion of the blood is plasma, so that is removed, and it is removed and separated from the blood cells. So it is removed and separated from the blood cells, and then this is mixed with protein solution. Okay, it is mixed with protein solution albumin. Okay, it is mixed with protein solution albumin, and then after mixing this, it is again put back into the body. Okay, it is put back again into the body. So this is done mainly because this plasma usually consists of antibodies. Okay, this usually consists of antibodies. If these antibodies are abnormal, then we have to change this antibodies, because I have told you multiple sclerosis, it is usually it is usually caused by immune system malfunction. Okay, it is usually caused by this immune system malfunction. So that is plasmapheresis. So what is done in this plasmapheresis? Plasmapheresis we do only when the person is not reacting to corticosteroids, then we go with this plasmapheresis. What we do, the liquid portion of the blood, that is plasma, it is removed and is separated from the blood cell, and then it is mixed with protein, that is albumin, protein solution, that is albumin, and then again it is put back into the body. So that is plasmapheresis. Then we go with giving them beta interferons. Okay, thus we go with giving them beta interferons. This beta interferons, it is usually given under the skin. Okay, it should be injected under the skin or into the muscle. Okay, it should be injected under the skin or into the muscle. So this can reduce the frequency and severity of relapses. Okay, it can reduce the frequency and severity of the relapses. So next is that beta interference. Beta interference are usually given under the skin or into the muscles. This is usually given mainly to reduce the frequency and severity of relapses. Okay, it is mainly given to reduce the frequency and severity of the relapses. So what are the example for this beta interferons? It is mainly Avenox and Rebif. Avenox, AVONEX, Avenox, and Rebif, REBIF. Okay, REBIF. So these are the example for this beta interference. So what is done in this beta interference? Beta interference, it should be given under the skin, beneath the skin, or into the muscle. This is mainly given to reduce the severity and frequency of relapses. So this is about this beta interference. And the next thing that we give, it is mainly glatiramar acetate. Okay, glatiramar acetate, glatiramar, RAMER, acetate, ACETATE, glatiramar acetate. So this medication blocks the immune system attack on myelin. Okay, so this will block the immune system attack on the myelin, and this should be injected beneath the skin. Okay, this should be injected beneath the skin. So what is this glatiramar acetate will do? It usually blocks the immune system attack on the myelin. This should be given beneath the skin. Okay, this also should be given beneath the skin. So example, it includes Copaxone, COPAXONE. Okay, Copaxone, 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 and Glatopa, GLATOPA, Copaxone and Glatopa. So this is a medication that is usually given and should be given beneath the skin. So this is about this management. So management, we start with corticosteroids, that is methylprednisolone and prednisone, and this is given mainly to reduce the nerve inflammation. Next is plasmapheresis. When corticosteroids is not responded by the person, we go with this plasmapheresis, where the plasma is removed from the body and then it is mixed with protein solution and it is being injected in, it is given back into the body. And next is beta interference. This is given mainly to reduce the frequency and severity of the relapses. Example are mainly Avinox and Rebix. Next is glatiramer acetate. This is mainly blocks the immune system attack on the myelin, and this is also given beneath the skin. Example is copaxone and glatopa. Okay, copaxone and glatopa. सो मैनेजमेंट हम लोग यहाँ पे शुरू करते हैं कॉर्टिकोस्टेरॉइड्स. कॉर्टिकोस्टेरॉइड्स हम लोग इसलिए देते हैं ताकि हम लोग उसका नर्व इन्फ्लेमेशन को कम कर सके. जो एग्जांपल होगा प्रेडनिसोन और मीथाइल प्रेडनिसोलोन देते. मीथाइल प्रेडनिसोलोन हम लोग आईवी में देंगे. अब जब कॉर्टिकोस्टेरॉइड्स उस बंदे को काम नहीं कर रहा है, जब बॉडी में उस बंदे को कॉर्टिकोस्टेरॉइड से कुछ काम नहीं हो रहा है, तो हम लोग स्टार्ट करते हैं प्लाज्माफेरेसिस से. प्लाज्माफेरेसिस में क्या करते हैं हम लोग, जो लिक्विड पोर्शन होता है ना ब्लड में, उसको हम लोग निकालेंगे, उसको प्रोटीन सोल्यूशन में मिक्स करेंगे, दैट इज एल्बुमिन में मिक्स करेंगे और उसको वापस बॉडी में डाल दिया जाएगा. इसलिए डाला जाता है क्योंकि अबनॉर्मलिटी होगा एंटीबॉडीज में, तो उसको हम लोग चेंज कर सकते हैं. क्योंकि ये इम्यून सिस्टम मैल फंक्शन की वजह से हो रहा है, तो इसलिए हम लोगों को एंटीबॉडीज जो प्रोड्यूस करता है उसको निकाल के दूसरा डालना है, तो जिसकी वजह से वो कुछ इफेक्ट नहीं करेगा बॉडी को. और तीसरा जो मैनेजमेंट हम लोग करते हैं वो बीटा इंटरफेरॉन से. बीटा इंटरफेरॉन ये ना स्किन के नीचे दिया जाता है या मसल्स में दिया जाता है. ये देने से क्या होता है, जो रिलैप्सेस होता है ना उसका फ्रीक्वेंसी को और सिवियरिटी को रिड्यूस कर सकते हैं. तो एग्जांपल यहाँ पे जो हम लोग देखते हैं वो एविनॉक्स और रेबिस दिया जाता है. और चौथा जो हम लोग यहाँ पे करते हैं वो है ग्लेटिरमर एसिटेट. तो ये इसलिए दिया जाता है ताकि इम्यून सिस्टम को ब्लॉक कर सके, ताकि वो माइलिन पे अटैक ना करे. इम्यून सिस्टम को ब्लॉक करता है, इम्यून सिस्टम को रोकता है कि वो माइलिन को अटैक ना करे. ओके, ताकि वो माइलिन को अटैक ना करे. ये भी स्किन के नीचे दिया जाता है. एग्जाम्पल होता है कोपाक्सोन और ग्लोटोपा. ओके, कोपाक्सोन और ग्लोटोपा. तो ये हो गया मैनेजमेंट ऑफ मल्टीपल स्क्लेरोसिस. तो हम लोगों ने यहाँ पे डेफिनेशन पढ़ा था मल्टीपल स्क्लेरोसिस से, मतलब ये पोटेंशियली डिसेबलिंग डिजीज़ है जहाँ पे ये नर्व्स ऑफ सेंट्रल नर्वस सिस्टम को डिटोरिएट करता है. और एक और है द इम्यून सिस्टम प्रोटेक्टिव शीट जो होता है माइलिन को अटैक करता है, जिसके कारण कम्युनिकेशन प्रोसेस में तकलीफ होगा. सो दिस इज यूजुअली potentially disabling disease which usually in which where their nerves of the central nervous system will be deteriorating, and also the it usually affects immune system, starts affecting the protective sheath, that is myelin, which causes communication disturbance between the brain and the other parts of the body. Incidents we had studied where 35,000 people of USA are affected by this multiple sclerosis. Women are more likely to develop this compared to men. Causes, it was usually seen that unknown, or it might be due to immune system malfunction, and few things it has been related that it might be combination of genetic and environmental factors. And next is usually symptoms. Symptoms, I have told you that it might vary from person to person. The symptoms, it includes like numbness and weakness, electric shock sensation, tremor, lack of coordination, blurry vision, partial or complete vision loss, dizziness, slurry speech, pain in the affected part, bowel and bladder dysfunction. Diagnosis, it usually seen that I have told it mainly includes MRI scan, CSF analysis, history collection and neurological examination. Management, it has already told that corticosteroids, plasmapheresis, beta interference and this is glutamate acetate. Okay, so this is usually about this. This is about this multiple sclerosis from definition to management. आप लोगों ने समझ गया. प्लीज़ वीडियो भेज रही हूँ, वीडियो को चेक कर लेना और पढ़ाई कर लेना. डाउट होने से मेरे को पूछ सकते हो. थैंक यू.